assalamu alaikum, ji ayanu, pakhera, ghaleni, hama, chunashume, washmale, ohaya, gunzaimas, hi, hugs and hellos to all those beautiful, amazing people who are tuned into PT World and PTV Global at the same time and are watching World this morning alongside Shazad Khan and Maha Makdoom. Hello, Maha, how are you?
I'm very good today. Shazad, you're still not well, are you?
Yeah,
Like,
I'm
I can
not.
see you covered in your shawl
The
and
only
stuff.
reason I'm covered is because of the fact that, you know, I'm sweating, but
you're
then at the
cold.
same time I feel cold as well. So people, please look after your health just because it has not been raining. So there are quite a lot of viral diseases going outside. So may it be men or women, please look after yourself.
Exactly. Birth people need to look after themselves, but today we're actually focusing on women today. And I feel really bad because you're the one who's sick.
It's perfectly
But maybe
all
we
right.
can pick up some like tricks and so that you can get better.
Exactly.
But as Shazad mentioned, you know, if you don't feel well, then you're not up to 100% and you cannot perform, you cannot be as productive as you would like to be. And especially for women within this culture, there's a lot of pressure on them. They have to look after the children, they have to look after the household. And if you live in a joint family system, you have to look after the parents and then the brother-in-laws and etc. And it goes on, the list goes on.
And you know, the only thing which gets me worried about women is that they're working 365 days a year. 24/7 because, you know, they just do not get Sundays or Saturdays off because of the fact that, you know, kids are going to roam around every day. Mom, please do this, do that. Please, can you make this for me? So they just can't stop. So
exactly. So they need to be in 100% healthy fitness.
Yeah.
And so basically, we're going to be discussing that today. Within Pakistan, there are certain common issues that women face, which can be easily resolved, which we don't tend to address because we're like, it's just, you know, it'll be fine, everything will get better. We also tend to leave a lot to God, but God also wants us to look after ourselves as well.
Exactly.
And within the rural communities as well, there are different issues that are going on. We're going to actually talk about very important things today. We're going to be talking about maternal health care, maternal morbidity as well, because a lot of mothers die during birth care as well, birth. And also another thing we're going to be highlighting is the other infections and diseases that you can get.
Other than that, I think the two of the most common cancers within women is the cervical and the breast cancer as well. And then, you know, quite a lot of women, you know, they have to give up on their lives just because of the fact that they didn't go to the doctor earlier. Exactly.
So today we have been joined by some wonderful people in the studio and we're going to discuss with them what is the situation and how can we make things better. So I'm going to grab up my names because all my information, everything's gone wrong today. But today we've been joined by Dr. Taqdees Nakesh. She is a gynecologist. Assalamu alaikum, good morning. Thank you so much for joining us today.
Thank you so much.
Besides Dr. Taqdees Nakesh, we've been joined by Dr. Ghazala Bashir. She is a gynecologist and an infertility expert. Assalamu alaikum, good morning. Thank you for joining us today. Besides Dr. Ghazala, we've been joined by Dr. Mariam Hashim Bashir, who is a psychiatrist. Assalamu alaikum, welcome back.
Thank you so much. It's a pleasure being here as well.
Well, thank you for stop having holidays and thank you for being here. Besides Dr. Mariam, we've been joined by Dr. Naseem. She is an infectious disease specialist. Assalamu alaikum, good morning.
Thank you very much for inviting.
Thank you so much for joining
us.
us.
The only thing which I didn't knew today was that what are infectious diseases? I mean, we can obviously name diseases, but then what are infectious diseases? Let's start from here.
Yeah, that's very true. Most of the people, they don't know. Actually, in Pakistan, the subject of infectious diseases is very, very much new. And we have the departments of infectious diseases in very few hospitals in Pakistan, like in very big cities like in Karachi and in Lahore. And one of the centers at Islamabad also. But since this has not been recognized as a subject at the undergraduate level as well as in the hospitals, it has not been given as a recognition as a separate entity.
Okay, that's great. So what is an infectious disease and what is a sexually transmitted infection? So what are these differences?
Yeah, there are a lot of infections which are prevalent in our society, but as far as we talk about the sexually transmitted infections, they are also very much prevalent. And most of the times the women usually they do not come in time for early recognition of these diseases. Therefore,
That's great. We will discuss all the different infections. But what is the difference between an infectious disease
and an
STI?
Okay, sexually transmitted diseases actually, as the name indicates, they are transmitted through the sex.
Right.
So since there is an exposure to the mucosa, so there are high chances of transmission of a disease, particularly through this route.
Right, okay. And so what is a normal infectious disease then?
normal sexually transmitted
No,
infections.
no, just a general
Just the
infection.
infection.
Generally, we have a lot of infections in our society which are prevalent. As you know that there are viral diseases, there are bacterial infections. We do have fungal infections in special populations. And besides that, there are certain special and specific populations who are prone to develop certain infections like HIV/AIDS or hepatitis B viral infection, Hep C infection.
Okay, things like that, right? Okay, we understand now. Okay, so we've got that clarified. So now let's bring it back to the conversation, which is about women's health. Let me start with you, Dr. Tagdis. What are the general problems that women come to you for with issues? And we may want to put our phone on the floor because it's vibrating.
That's from the
Oh, this
hospital.
is fine.
Yeah. I
Okay.
have put it off.
That's
Yeah.
perfectly all right.
Great. So
Yeah.
what are the main common issues that women come to you with?
Your good name?
Maha.
Sorry, I forgot.
That's fine.
The most common issue in Pakistan, what we have seen in our practice is anemia.
Right.
Everybody can understand the world of anemia means the lack of this hemoglobin or the low hemoglobin. All over the world, the people have overcome of this problem because the most of the complications even during delivery and before delivery and during delivery are because of the anemia.
Right.
Might be you have heard there is a lot of bleeding happen during the delivery. So the name of the hospital and name of the doctor comes on the newspaper and media, you know. And the basic cause is, believe on me, it's in 90% of the cases is anemia. According to the WHO definition, 11 or below 11 is what we call as anemia. And then there are different categories, mild, moderate and severe.
So how do we get to that point? Why are so many people why are so many women within this country suffering from anemia?
And it
As
does not,
she- as-
it just
yeah,
not
sorry.
happens after the delivery. I think it
Before as
happens
well?
in between the pregnancy as well.
Yeah, yeah. As Shahzad mentioned in the initial of this phases in this program, women usually work 360 days.
Yeah,
Yeah,
yeah.
yeah.
5 days, okay,
yeah,
they can
5
take
days,
it off.
5 days off. So I mean, they focus on their health very less,
Okay.
but on the family, and the children, the husband, 95% I can say the
Okay.
main focus is on that. So the eating habits. And as in urban areas, I can say 85% of the population, they are eating very low.
Okay.
I mean, especially the women. The best of the stuff they usually take the son and the husband and the elders of the family. But for the female who works 24 hours a day,
Yeah.
She's not eating.
they are not taking the quality of food.
Okay,
Yeah.
so Dr. Ghazala, so tell me, what specific types of nutrients does one need? What do they need to pay attention to?
Yeah, basically in the women health, let me first categorize what diseases or what conditions comes in women health.
Yeah.
If we categorize it like adolescence, then we can say reproductive period, and then we can say that old age.
Right.
If we should categorize in
down.
this, yeah. In adolescence, there are different conditions in which we can say that these are the women, these are the issues which are more have priority in case of adolescents.
Right.
In that case, like Dr. Tagdis said, that the basic thing which in our society is anemia.
Yeah.
That is the main priority. It starts from the teenagers. When the health is, say, deteriorated because of less intake of the food, like iron, you said what nutrients should be. In anemia, iron is very much important.
Okay.
Okay. Vitamin B, B complex, that is very much important. Proteins, balanced diet,
Yeah.
Right.
whatever, it's fat, protein, everything is important, but related to anemia, iron is very much important. Okay?
So, but
And we
why
should-
are we not eating these things? Because
Okay, now
as
what-
in-
We,
Yeah.
Because it's
actually,
there.
the thing is a lack of awareness.
Right.
Otherwise, everything is available, and we can say not in different things. We can have these iron and everything, but we don't know in which food stuff iron is present.
Okay.
Okay,
the
but then
things.
what are the different eating habits as well? I know that, today we are emphasizing on women's health as well, but why don't boys get anemic as well, or men?
Or do they?
But is it because of the different eating
no,
habits?
because it's because of the cyclical. One thing is that they have this periods, and that's why they lose every month. They lose blood.
Yep.
Okay, and the other thing is again that is the gender discrepancy, because in our society they give good food to the male.
Yeah.
And less.
That's
food-
more in the
yes,
developing and the rural
But
areas.
developing is important,
Oh,
because
of
our
course, absolutely.
70%
Absolutely,
people
and-
live in developing side.
But then what about all those women who love dieting so much that they
Yes,
forget
again,
eventually
in
that
this
you know, they have to
society,
eat?
if we say urban society, then that is the main problem, that they don't want to eat and they don't take food much.
Okay,
Let's say.
we'll move more on to the eating habits as well. That's fine. But now let's talk. Okay, so we've talked about certain physical issues that women are dealing with. But now let's bring into the psychological aspect of it. One of my favorite aspects of life. Oh, thank you. I don't know. I don't think so. It's been
studied
really
the
bad
same
these
thing,
days.
that's why.
But now, what are the problems that women are coming to you these days, Dr. Mariam? Because there's a lot of problems, especially within a developing country. There are different pressures, cultural, religion. So what are you facing a lot these days?
Maha, when we focus on the community, they are usually focusing on morbidity associated with other diseases.
Okay.
And diseases, whether it's mental health or physical health, they just focus on the factors associated with the morbidity and mortality.
Okay.
But nobody is now focusing on the gender determinants.
Okay.
And gender determinants are very important, especially regarding mental health.
Okay.
When we talk about the global burden of disease, psychiatric illnesses, it's about 14% to 17%. And out of that, 7% of the affectees are actually women.
Okay.
And by the year 2020, depression will be the world's second largest killer.
Right.
And
Because it
out-
leads to leads
Yes.
to suicide, leads to a lot of different illnesses, correct?
Definitely,
Okay.
definitely. And then, depression is twice or thrice as common in women as compared to males.
But why is
Yeah.
that?
What leads them towards depression?
Like, a woman faces different stages during her life cycle. There are lots of transition, starting with the premenstrual, the onset of menarche, and then we talk about perinatal and postnatal health, pre and perimenopausal health as well. So there are a lot of transitions, and then infertility.
Yeah.
So, these are lots of life cycle transition, marriage in itself, childbirth in itself. These are social determinants which make women more prone to developing illnesses
Okay.
like depression, anxiety, infertility. And we have to stop thinking that we're different from the West.
Okay.
Even substance abuse is a very common factor in women. And
And it's increasing day by day too, I think.
Yeah, because I think people are dealing with these issues. Is
And
that
something
correct?
very interesting is that suicide attempts are more commonly attempted by women, even though males are more successful because of the lethal weapons that they're using.
Yeah.
Okay,
So-
it's not.
So for women, it's just attempts.
No, because
Sorry for that, though.
No, because they're not probably they're scary, right? I mean,
But
you
please
have
don't do that. I mean,
And-
for all those people who
And
are out
Maha,
there.
we can't sort of underestimate the stigma that women are associated with illnesses. We sort of tend to make stereotypes of genders as well.
Pagal hai. Like
Yeah,
that's what you're saying,
stereotypes and say trying to tell us that women are more prone to emotional problems and everything, even though it's because they're not heard and they're stigmatized, and there's a barrier of help seeking and treatment seeking, and there's no
Okay.
diagnosis of illnesses.
Okay, so no, that's really important, because I think what I've been noticing, because you can deal with a lot of issues or hurdles life throws at you if you are mentally and psychologically stable and everything's fine.
And then at the same time, what I wanted to ask was, how does discrimination actually make women lead towards depression as well? Because half of the time, Dr. Saiba just mentioned that, whatever is best to eat, they give it to the father or to the son as well. So, all of your life, when you have been
You're
going
a
through
second
all of
citizen.
these
You're the
things,
second.
how does it actually have an
Shehzad,
impact?
when a man feels depressed, he would be taken to a psychiatric hospital. When a woman is depressed, she would not be heard at home. They would blame it on the social factors.
Or
And what would
emotional.
happen is she, instead of verbalizing her distress, she would somatize it. She would never come to you and tell you, I have weeping spells, I haven't been able to sleep. She will always come up with either a headache or a dupatta tied around her head.
Yeah.
And she will have to somatize the symptoms.
Yeah, like in the rural areas, they say that, a jinn charigya, like as in this.
Possession.
And that's not
Yes.
just
Yes.
the rural areas as well. Let me
Is
just
it
tell
not?
you.
Even in
No.
urban.
wow.
Even in
Yeah,
urban. Even in
okay,
urban.
I
Urban
wasn't-
areas.
okay, I didn't know this.
Yeah.
Either it's the jinn and possession or it's a somatic illness.
Flani
Okay, now the
Phupho ne
thing-
Flani Khala ne kar diya
Okay.
to yeah.
Actually, the thing is, in the female, there is other things like hormonal disturbances or hormones.
Exactly.
They are working in the whole
Okay.
stage of the life. Say, from the start, the hormones are.
As soon as you hit teenage years, puberty,
yes.
it's
In
downhill for women
teenagers,
after that
that's
struggle.
right, that's
No,
right,
okay.
because of that.
Okay, now the thing is, we've known about the way the bodies work. We know women's bodies are different. You have the hormonal cycles. You have, postnatal, prenatal, postnatal. Then you have like menopause. All these things.
That's right.
Now, we're in the 21st century. I want to ask Dr. Mariam this before we move on to Dr. Naseem. Why is it that we are still discussing that when a female has this like hormonal imbalance or whatever, why are we not able to handle or tackle it still?
Number one, illiteracy. Illiteracy. We have not had enough research in the rural areas and in some of the urban populations, so we lack a lot of evidence. We're trying to follow the models of the West, which doesn't work for us. You know, the illnesses that we have are prevalent in different figures as compared to the West. The problem is much more grievous here than in the West.
No,
that's one of the reasons there is no policy making for them. There's absolutely no policy making. And then, you know, most of our population is living in the rural areas, and they have come in contact with not health professionals but the primary healthcare providers.
Right.
And those primary healthcare providers are not educated enough, or maybe they're not sort of at a better way to deal with or diagnose mental illnesses and distress as
No,
well.
but then at the same time, what I wanted to say, first of all, when we talk about rural areas, the type of, you know, medical facility you get over there is maids or all right, midwives.
Agreed.
And then other than that, are we able to identify if a woman is actually going through a hormonal imbalance as well?
That's
what the problem
That's
is?
the problem, you know.
They just start getting upset and angry. Or
That's
maybe.
exactly the problem. The primary healthcare provider sitting in that BHU or the district health hospital is not able to recognize, because the dai would have her own opinion in her mind. You know, you can often hear things like in perinatal depression, oh, wo sardi lag gayi thi, thand lag gayi thi, hawa lag gayi thi, ya jinn chad gaya, like we just mentioned earlier. So they aren't able to recognize that this is actually a hormonal surge which is causing the perinatal illness, and eventually when the woman eventually ends up either killing her child or killing herself, they even try to conceal that. It's not reported. There's no research. There are no results, no policy making, and that's how we haven't been able to tackle
That's really detrimental to actually the evolution of this society. Okay, now, Dr. Naseem, what are the main infectious diseases females are coming to you with?
Yeah, as my colleagues are already discussing about the level of literacy which we have, most of the females, they belong to the rural areas, and even for that matter, those who are living in the urban areas, they suffer from multiple diseases, and they do not come to know that they are actually suffering from the illness. The most common disease which we encounter in the females, which I have seen, is the tuberculosis.
Tuberculosis, okay.
Yeah, it's still on the top, because most of the people, they are living in overcrowded areas, they are poor, and besides that, they are illiterate also.
Right.
And by the time they reach the doctor, they already have the disease in their lungs, and sometimes it has disseminated to the other organs also. So tuberculosis is one. So this is a major issue, and I feel that it's all over in Pakistan. So we must be taking care of this aspect, because most of the diseases which we are facing are preventable.
Okay.
Yeah.
So Pakistan
Thank
is
God.
at this moment suffering from preventable diseases, which actually should be addressed. Like you must be hearing about dengue fever, malaria, and things like that. So I think we should be really working hard to prevent those diseases which we can actually prevent.
Okay,
And
so
besides
tuberculosis
that,
is one of them.
tuberculosis is one.
And only if they're in time as well. I mean, if they go to the doctor in time, only then you can
But that comes with
prevent it.
awareness, right? So,
Yeah.
okay, now in regards to other infectious diseases, apart from tuberculosis, what is the other biggest threat to women in Pakistan these days?
As the women's, they don't eat properly, they don't have their dietary supplements in their food, they actually are having lack of immunity in their body, and this is the main issue. And as I told you, tuberculosis is one, but another thing is that if their partners are suffering from some sort of illness, they are more prone to develop that illness. And among these, we have hepatitis B viral infection, hepatitis C infection, and then HIV/AIDS. Although in most of the world you see that HIV is transmitted via the sexual route, but through the homosexual route. But at Pakistan, because the females are the receptive partners, they usually are getting this disease through their male partners, and they are the husbands.
And you know, I've got a piece of advice over here as well. You know, since you were talking about policy making, you know, whenever there's somebody getting married, why can't we make it mandatory to go through a screening as well. I think that'll probably
I
save
do
quite a
that.
lot of
I
lives.
think people do
Just,
that these days.
people are not going to like it, but still, you know.
There are actually a lot of illnesses that we need to be screened from. This is like a sort of
Yeah,
a different
yeah.
topic here, but thalassemia is one that you need screening
Yeah,
for.
yeah,
Exactly.
Even
I'd like to
CA,
highlight.
Definitely.
I
Sorry?
would like
CA cancer.
Yep.
Yeah,
Okay,
genital-
let's bring it back to
they
this.
are-
Yeah, I would like to add in this infection diseases, as you have used the word of screening. All over the world, in antenatal booking, HIV is mandatory.
Yeah.
I can remember, actually, I worked a lot in Gulf when I moved to Pakistan. So I used to write HIV for all the antenatal bookings. And for just prescribing this test, there was a lot of problem at home. Why the doctor has advised? Definitely, doctor has came to know something, some suspicion or something like that. So I have to stop it, you know.
Okay, so it's
So there was
basically
that.
that people's
Yeah.
mentality.
mentality. Yeah.
People are
it's
really
sort of
Maha, you know, there's a similar
We go to
issue
the Gulf countries, so let's address this. Yeah.
with this, there's a similar issue with infertility. Even though, I mean, the male could be responsible for
Yeah,
the infertility, but it's usually blamed on the woman. There's a lot of stigma attached. And then the woman has this fear that she might have a daughter that the husband does not want.
Exactly.
Even though the male partner is the determinant of the
Okay,
sex
now
of
the
the
thing
baby.
is, I want to highlight these things. So now all of these problems, which could lead to a better life, an easier life, causes problems before. Now, all of these things you haven't, majority of people don't do them. Now, this is why we're having these discussions. Psychologically, what is the impact? Because at the end of the day, we're talking about the harmony of the home, or the harmony of your child, your daughter, or your sister, or whatever. By ignoring it, what are we actually, what are the consequences of this?
The woman is basically the carer of not herself, but she's the carer of the family's health as a whole.
Exactly.
Because she's looking after the children, the husband, the extended family, the in-laws,
One
her
lineage,
parents,
yeah.
and the community at large.
Yeah.
So, and that's where you sort of nurturing and, the nature versus nurture debate. This is how the starting of the education for children is decided, right?
And while we talk about education as well, since you picked up on infertility as well, so for all those men who actually blame it on women, it is quite cheaper for men to get tested.
yeah.
You do
Honestly.
that first.
Do that
cheaper,
first
it's
and then
just
move
cheaper
on to the
to
And
next
they're the
step.
determinants of the sex of the baby as well.
It's like, yeah, exactly. The male decides that. So now the thing is, now how do we go forward with this? Because at the end of the day, we're not just here to highlight the issues. We're here to show women how do we tackle these things? How do we tackle this culture of kind of hiding everything and not actually owning life, basically?
And to go forward, before you answer, I think we need to go for a short break. But we'll be right back. People, don't go anywhere. And very good morning. Thank you.
在我的这课堂上，在我的这40分钟，我希望他们能够快乐一点，能够快乐的学习语文，就不要感觉到这就是一个这个课程，然后我不得已我要去学习它，而是主动的由他发自内心的去喜欢语言，喜欢国家的具有几千年历史和这种文化底蕴的这样一个课程吧，我是这样一个想法。
All right, ladies and gentlemen, welcome back. For everybody who just tuned into PT World, you're watching What This Morning alongside Shazad Khan and Maha Makhdoom, and today we're emphasizing women's health. Earlier we were talking about infectious diseases and the difference between STIs, infectious diseases, You know, we've
Lots
got
of things.
gynecologists over here, infertility experts, psychiatrists over here. So, you know, we're kind of covering every aspect.
We're covering every aspect today. So before the break, I asked Mariam that, you know, psychologically, what is, you know, what's going on in the 21st century?
I think you were
How-
talking about the impact and then what the
How
way
do we-
forward is, right? So
exactly.
there were two different questions. So when we were talking about impact, I told you that the whole family is sort of disturbed by the way the woman is because of the mental health and issues that she has. Depression and anxiety in women is very common. A woman who's depressed or is anxious or suffering from a psychiatric illness, how do you think she'd be able to look after the baby and the family as a whole as well?
Obviously, it's going to be
So-
irritable and angry. It's anxiety and depression.
Is the commonest.
What kind of behaviors are there? Like, how can people pick up? Like, for example, a family need to pick up on these, you know, kind of hints.
Like I said earlier, the women in Pakistan or in Asian areas or rural areas will never actually come and tell you that they're feeling depressed or feeling low because nobody's going to pay heed to that, you see.
Right, yeah.
So they will have to either, they can't verbalize their distress, they will have to somatize it with some physical complaints which have been diagnosed and have been treated and
Which
have
you
been
said.
investigated multiple times by multiple medical specialists and gynecologists. So eventually when nothing is working, somebody would just refer them. Sometimes even the faith healers are themselves recommending people and they're referring them to us.
Yeah.
That, you know,
Excellent.
yeah, which is good because, you know, we...
And I've seen faith healers coming to psychiatrists by themselves as well.
That happens,
Sorry,
by
but
the
I've
way.
seen that.
No, that's true. That's
good.
absolutely true.
Yeah.
Okay.
So that is one issue that you're facing. And then, you know, we cannot deny that there's also a lot of substance abuse in women as well. We sort of tend to blame women in urban areas for taking, for taking hash or smoke and alcohol. But what about the hookah smoking in the communities, in the rural areas as well?
Okay.
So we need to highlight that as well.
Okay.
Right. And then, of course, as I mentioned, suicide, which goes unreported. So these are the different issues that women face.
Okay, now how do we deal with it now? How do these women, you know, deal with the fact that they are secondary citizens? They always have been treated
Well,
like
they're
that.
not.
They,
Come on.
We need
when
to
in the
work-
rural areas, when
Look
the
at all
food
these
is,
women sitting over here
we're,
talking about all these
we are
issues.
not an accurate representation of the society.
Okay.
We are the minority. The majority live in rural areas where the men do get the
Yes.
best foods, they get the best sleeping areas. So
And
yes,
Shahzad, I'm sorry if I may correct you, even in urban areas, lots of women from urban areas, from Islamabad, Lahore, Karachi, come to us as patients and they say, oh, you know, my husband is like really educated, my in-laws are really educated, he studied abroad, but at home, I mean, there's a lot
very
of chauvinism
different.
associated.
Yeah. Okay.
So if I may
so
say
yeah,
so,
let's
this
not
is-
That
paint
is
a, you
there.
know, like a
Yeah.
perfect picture because
Yeah.
every society has its issues.
But in
So
rural
that's-
areas, I think women are more dominant. They go to work.
Really?
Yeah.
Well, without them, the
So
families don't survive.
I would say the way forward is awareness and education as a whole. I mean, you guys are doing a great job by highlighting this on the media. That's one way that you follow. So
And
they
we're
should
trying
have
to
more
create a
channels and
balance
more
too.
languages, like even Punjabi channels and Urdu channels like the English channel, because we want to do this for Pakistan and the community as a whole,
Okay.
not
Yeah.
in an
Okay, so
isolated.
education now. Okay, now education, but that starts at home. So how do we educate the husband, the brother, the in-laws, the parents?
And
about
then,
it?
you know, the vicious circle, if it's starting at home and the mother is starting the education, if the mother herself is not aware and she herself starts believing that there's some sort of jinn or possession in her. So for the education of the family as a whole, you know, again, like I mentioned, media has a very important role to play to educate the men. And then communities and the primary healthcare centers should have people going in for counseling.
Okay.
Mental health professionals and other health professionals from other fields should actually go there, have camps there, educate the people over there, involve them in a counter.
Okay.
But then women have to do it by themselves as well. You cannot still rely on fathers and brothers or husbands probably because
what?
you know, for all of these awareness programs as well. I mean, for example, if you need to know about all of these things or probably you want access to the best medical facility, women need to
Is
stand
that a
up by
woman who
themselves.
cannot go to her neighbor's house without a dupatta? How do you think she would sort of...
So I think this is what we need to change.
Yeah, exactly.
This
So
is
it
what
has
we
to
need
start from the
change.
men as
Yeah.
well. It's a joint effort. The men and the
Yeah.
women have to work together.
Educating the men of the family is more important.
Yeah.
You know, usually when women come to me for depression, I have a session with them and then I have a session with the husband alone and trying to explain to them that this is actually a neurotransmitter abnormality and it's not that she's putting up a drama or something.
Okay.
So this is one of the issues that you
And
need to
things
solve.
these can be resolved. Now, okay, now that's the psychological aspect. So now let's bring it back to other illnesses that women are dealing with within Pakistan. And cancer is one of them, and it's quite high: cervical cancer and breast cancer.
Yeah.
Now, I'll start with you, ma'am, and then move on to Dr. Ghazala. What is the situation, and how bleak or positive is it?
Yeah, Maha, you have touched a very sensitive and very important topic. Cervical cancer is definitely very, very common. Same ratio as earlier. And when we read all these things that in Britain they have overcome this problem 80 to 85%, we usually feel very bad. There is no awareness even in a very good class, in elite class as well. When the patient comes to us, the first test is Pap smear. It's just a small and cheap test. Even less than 1,000 it costs.
Okay, but one thing, just to highlight, which because I was doing research, is that if even unmarried girls or certain other ages, if they go, then the hospitals are very reluctant to do these kind of tests, no?
Yeah, before marriage, cervical cancer vaccine is also available, starting right from the age of 14. So we can protect our daughters right now, even just 2 injections.
Okay, excellent.
Yeah, and with the interval of within 6 months, they will get these 2 injections, and later on, after the married life, even then they can get these injections. There are
What are the causes of cervical?
As you mentioned earlier, sexually transmitted. Mostly, it is sexually transmitted.
Then we have to
HPV.
emphasize on unprotected relationships as well. I think that's what we need to talk about.
Yeah.
So let's build it up.
Build.
Yeah.
So, very important screening test, as I mentioned about the Pap smear, should be done for all the women.
Most what age?
From after marriage,
After
definitely.
marriage, okay.
And before that, vaccination we can protect it.
Okay.
Every 3 years.
Right.
If the previous one are normal, every 3 years till the age of 60, they can do a simple test, is that.
Okay.
And awareness about the reading material and vaccination, we can protect in large in our Pakistan.
And then what do you have to say to all of those husbands who think that, after getting married, their wives are actually baby production machines as well?
Let's
No
also do
gaps,
this
no
on
nothing.
reception.
Yeah.
Yeah, that's very
How do you
important
affect
topic
the health
because,
of your-
because when the mother, if she has more children and more than 5, say, then she will be weak. She will be anemic. She will have other deficiencies. That's why the spacing is very important.
In this day and time, though.
Yeah.
Yeah, so that's what the question is, is that how much space, how do women protect themselves from becoming a baby-making machine? As in, every year there's a new child.
That again depends on their own will. Say, the women should decide herself.
Okay.
Okay, but the thing is, like, if I say medically, it's at least 3 to 5 years.
You should have a break.
Yes, you should have a break. But if the women, if the thing is, now everything is changing basically. We don't have to impose on them, on the women, that she should space for 5 years and she should space for 3 years. She should decide herself.
Okay.
Okay,
But the thing is, a woman can make a decision once she has all the information, and so that's what we're trying to get at.
That's the main point. She should be aware of everything, and that's again, doctor, as said, she said that education and awareness is very important.
Okay, then one more thing, since we're talking about education and awareness as well, I don't know whether how many of you doctors will agree to that, but then half of the time it's the doctors as well who basically deteriorate the situation of a lady. Now, why? For example, all 9 months of pregnancy, you're going to the gynecologist, you're getting checked up, everything's fine, superb. Right at the day of delivery, it can be a natural delivery just because of the fact that, the umbilical cord is all around the neck, it's going to be a cesarean. 3 kids, that's it, you cannot have any more kids. Now, who's responsible over here? Because if 9 months everything's normal till the last day, how can all of a sudden the umbilical cord go around?
Seems to
No,
that's not
5
the
fingers are not
answer.
equal, not figure. Yeah, you're very right. This is the most common cause nowadays, cord around the neck.
Exactly.
But it should not be the indication of cesarean section. It should not be the. So awareness and internet is a lot in the, usually the patient comes to read everything on the internet and they discuss with the doctor, it's not the indication. But the mother-in-law, again the family. If this thing happens, it should not happen, there should not be any risk for the baby. So all these collectively they end up with the decision of cesarean section.
Well, half
Not
of the
directly
time
the
I
doctor.
think that it's
Not
becoming a
everything with the
business as
doctor.
well.
That's right, you're right. In some cases, yes, but sometimes it's necessary. Sometimes,
When it's
yes.
necessary, okay, that's
right.
fine.
Like card around the neck is not indication for cesarean section.
Okay.
Okay.
So now we know this.
Yeah.
Okay.
I never knew that.
Well, now that's why we're doing
Yeah.
the show. Now you know. God. Okay. Now going forward, all these issues, it's a lot to do. Thing is, everything seems to do with it's a family decision for the girl and for the wife.
Yeah.
Just kidding, I'm getting a bit tired thinking about it. But anyway, going forward, because at the end of the day, you do rely on the medical experts at the end. And when it becomes apparent that there is not as much awareness as there should be, how do you, especially if you're from the rural community, protect yourself? Because you cannot, because you don't have the internet, you can't even write your name. So how do we expect them to know all these things?
There's contraceptives are available, and there is program like Safe Motherhood is one of the most popular program, and that is working in our country. Like contraception is also very vast, and it is in the rural area even, and they give them contraceptive devices and everything, whatever.
Okay.
But first of all, we should discuss with them. The thing is that they should, again, awareness, counseling is very much important.
Right.
We should counsel the patient even during her antenatal period. We should tell them that what are the methods of contraception and how you can use it.
And then one more thing which I wanted to ask, and you pointed it out, that quite a lot of substance abuse is going on. So for a lady who's pregnant, and if she smokes or abuses some kind of substance as well, how is it going to affect the health of the baby? Obviously, it's going to affect her health too.
Definitely. Yeah. Baby will be of smaller size, what we used to call in our terminology IUGR, intrauterine growth retardation. And it affects on the mother, of course, and directly on the baby. Growth retardation is the main factor, direct effect of smoking, alcohol, and all these abuses.
Okay.
And Shehzad, do you know that the baby also experiences withdrawal if the mother has been taking that substance and she stops taking it after a certain gestational month? Like the baby, when it's born, will experience the same withdrawal symptoms, like seizures and all that. So you're torturing the baby.
Okay, and the thing is, like, at the end of the day, like when you think about it, okay, yes, it's the mother's responsibility, but then if she is, when you're in a psychologically imbalanced, unstable state, if you're depressed or if you have anxiety, you're not thinking straight. Things are not going to. So at the end of the day, it's a vicious cycle. You need to create that environment so that they're safe, so they don't do these things. But one thing I want to make sure I ask you, Dr. Mariam, is that, Shehzad said, we said, oh, women have been they're secondary. Or even on your ID card, you are the daughter of or the wife of. You're not your own person. Now, it's true. Now, the thing is,
we are the son of as well. It's all right. That's how it will be.
But I mean, that's okay, that's fine. But still, it's in it's a patriarchal society. Now, when we talk about the thing, men do become like, oh no, but you have this, and you're just complaining and blah blah blah. How do we tackle that attitude? That it's just in your head, you're just being ungrateful, or that kind of fragile maybe ego factor, like what's going on?
We need to learn from better models. For example, the World Health Organization for Prevention of Suicide had this thing in which they called people gatekeepers. Gatekeepers were those people who were either living in the community within the rural population, like for example the midwives, the faith healers, the people in the primary healthcare centers, even the mullahs of the mosque and everything. So they involved them and they educated them, and they were able to guide the women. For example, if the midwives during the midwifery course are properly educated and brought to awareness, they'll be able to counsel them in a better way in their language instead of us going and trying to convince them in English. It's not going to be of any use.
Absolutely.
I can't speak Hindko. So if I go to a Hindko speaking area, the midwife will be able to educate that lady better than I will.
So it's a whole society.
If you want to speak Hindko, you just have to connect Acho and Gacho by the end or the start of the sentence.
I'm just giving an example that you need to involve that community instead of trying to be that figure and trying to change the world.
And then say
You
Acho,
got to change yourself, and every woman has to work on herself, and you have to change the local community first, and then the world at large.
And I think the women have to
steps.
work on their men as well. That's it. I mean, you have to work on your men first of all. You have to, connect with them. You have to sit down, which men does not really like to sit down and talk it out. But please do that if you can. I mean,
and
honestly.
send the girls to school.
Yeah.
Okay, look, sometimes too much communication is very detrimental. I have learned that as well. But also it is about getting that fine balance about it. But I think we have run out of time. Thank you so much for being here today and sharing all this information.
But anything by the end of the show, if you feel like adding on to something which we might have missed on every one of you.
I would like to add one thing, that the interaction between the doctors is also very much important. Like if a female comes to a gynecologist with for regular antenatal checkups, the patient should be referred for the regular medical examination as well, for at least thrice. First at the time of booking, secondly in between, and lastly just near delivery. So it's very important, because at the first visit we are going to screen those females for certain type of infections. If they have it, we are going to treat them obviously, and same is true at the end of the delivery. So this is very important.
Very good information.
Sure.
As you were talking about contraception, the latest contraception is immediately after the delivery of the baby, we can put the IUD.
Okay, great. We've
So
actually completely run out of time. Thank you so much.
This is very much important.
Any information we will share on our Facebook page. But you know, I was very lucky. My father was a psychiatrist, so he could sense the hormonal changes and everything like that. But it's all about paying attention, being aware, and just picking up little cues, and that will make your home much happier.
Exactly, and the only thing which I wanted to say, since it was about women's health, please, to all those men who are out there, please be a bit considerate and act like educated people as well.
Exactly. With that, you can log on to our Facebook fan page,
Which is with the name of World This Morning.
our Twitter page,
World This Morning without a G.
our Daily Motion and YouTube page.
World This Morning once again.
And the repeat is at
11 p.m.
Have a wonderful weekend, and we will see you bright and early on Monday.
Till the next time, look after yourselves. 1, 2, 3. Good
morning.
morning. Thank you very much.
Thank you.